With Chapter 18, we reach the end of our textbook and come back to the present. This chapter looks at the field of psychology and its systems and uses thereof in the late 20th century. So let's go ahead and get started. We've already looked at psychoanalysis, humanism, and behaviorism, neo-behaviorism in their own context, but in this chapter you look at their influence and their role in the field during the last century. For one, psychoanalysis remained strong after Freud's death and was a major system and approach to therapy in the 1950s. Through more attention of researchers towards applying empirical methodology to various psychoanalytic concepts, the system was able to gain longevity. Humanism, though it waned somewhat in popularity in the United States, remained strong outside of the U.S., where treatment and approach to psychology remained person-focused rather than pathology-focused, perhaps due to the medical results-oriented model we use in diagnosis and treatment in the U.S. In the second part of the 20th century, we saw a continued popularity of neo-behaviorism, driven by and large by B.F. Skinner's work and learning theorists like Bandura. And of course, as we already discussed in week 6, we saw the emergence of cognitive psychology and cognitive therapy as a reaction to the changing approach to the process of mental life and mental development. As psychology moved from the realm of philosophy and began to be more deeply related to how it may be used in an applied setting, we saw the real beginnings of cognitive psychology, and we saw this in the work of Freud, who not only theorized about human nature, but also diagnosed and treated so-called disorders. Thus, clinical psychology emerged not only as a science of mental disorders, but also a profession, as more and more professionals focus their career and work on largely, or exclusively in certain cases, diagnosis and treatment. We can see the tradition of clinical psychology not only in Freud's work, but also as rooted in the work of Dorothea Dix, focusing on the need of medical, psychological, and social intervention, as well as Leitner Whitmer, calling for the development of the field of clinical psychology. Some more recent and critical developments in clinical psychology are the fact that World War II generated a need for psychological services for veterans because of the unprecedented number of people who had gone to war. In 1949, David Shakow and others formulated the Boulder model that recommended that clinical psychologists be trained as research practitioners, and you'll see this term over and over again if you look at programs that are available for master's degrees or doctoral degrees at various universities. They emphasize the research practitioner model, particularly if you're looking at a PsyD, a doctorate in Doctor of Psychology. Excuse me. I'm just having a hard time with my words today. A PsyD is a Doctor of Psychology. In 1952, the American Psychiatric Association introduced Diagnostic and Statistical Manual for Mental Disorders, and we are currently on the revised version of the 4th edition of it, and we're looking at the 5th edition coming out sometime soon, perhaps in the next year or two. And in 1953, ethical guidelines were established for clinical psychologists, which is something that's very important for anybody who's dealing with people and who affects the lives of others. Some important people in the development and evolution of clinical psychology are Joseph Wolpe, who developed the method of systematic desensitization that many of you mentioned in your Indiana Jones projects. Also, Aaron T. Beck, the founder of cognitive behavioral therapy, who we discussed a couple of weeks ago. Another important influence is Marsha Linehan, whose work on mindfulness is currently very, very popular. In looking towards the future of clinical psychology, one hot topic, if you will, now is whether or not clinicians can prescribe medication to patients and the efficacy of medicine in general. And we'll talk a little bit more about the latter part of that when we discuss psychopharmacology a few slides down. We saw the rise in research of neuroscience in the past chapters, but as we move forward through the advancements in technology and science in the 20th century, particularly in its second half, we see the emergence of the biological neurological approach to psychology as a complete and discrete science or discipline. Carl Lashley, Donald Hebb, Roger Sperry, and Eric Kandel all contributed to the field through their work on physiological explanations for behavior, effects of learning on the brain, study of the cerebral hemispheres, and psychological models of memory, respectively. The advances in technology that I mentioned earlier include the EEG, the PET, and CT scans, MRIs, which are now standard in the biological approach to psychology. So you'll see a lot of prescriptions for these. Or what you see more frequently, actually, is the use of these in research, in finding where certain pathology may or may not be located. Neuroscience and largely biopsychology focused on electrical communication between neurons, hence the use of the EEGs and CT scans. Psychopharmacology, however, emerged around the same time, and a scholarly debate of sorts ensued about the nature of transmission. And this continued until Otto Loewy discovered the first neurotransmitter. Now, while both biopsychology and psychopharmacology are essentially rooted in physiology, psychopharmacology looks at the chemical transmission between neurons and studies the effects of drugs on thought and behavior. With this focus, it's really not hard to imagine why treatment with medication emerged and grew throughout the 1950s, especially with the development of tricyclics and MAOIs for the treatment of depression. Psychopharmacology really took off in the 80s and has now become a widespread way of treating depression, anxiety, bipolar disorder, and other pathology, especially in the United States. However, recent literature and research has looked at other types of treatments and compared it with medication, and they found evidence for relationships being just as, if not more, effective as medication. And when I say relationships, I mean therapeutic relationships, so talk therapy, that sort of thing. I believe we're going to see a lot more from both of these sides in the years to come, so do look out for that as you continue on in the field. A very big subfield, if you will, of psychology is social psychology, which is rooted in the work of Floyd Allport, about whom you read in chapter 17. He researched how groups and social influences shape behavior. Both Sheriff and Ash studied conformity, a major topic in social psychology. The work of both of these men demonstrated that social influence changes individual behavior. Another important topic is obedience, which was investigated by Stanley Milgram in his now famous or infamous, depending on your point of view, experiment where participants were asked to administer increasing electric shocks. This study showed that participants were willing to obey authority figures even when administering shocks which they believed were harmful. So think about that for a moment. They were willing to do something they thought was going to harm another person because somebody in an authoritative position told them to. This study, in a way, inspired Philip Zimbardo to study authority, and the result was that, again, famous or infamous, prison experiment that he did. These two experiments have raised many questions about ethical standards in research, and now there are strict requirements and guidelines for conducting research. In addition to studying authority and obedience, social psychology as a field is currently concerned with health psychology, social cognition, and evolutionary psychology. Another subfield which is enjoying growth is industrial organizational psychology, a discipline which applies psychological and social concepts to the workplace and work-related behavior. Both Freud and Dix recognized and emphasized, I would say, the important role work played in our lives. Hugo Munsterberg in 1913, in his book published in 1913 called Psychology and Industrial Efficacy, can and often is said to have been the birth of IO psychology, and IO standing for industrial organizational. And Follett's work on leadership and Scott's work on motivation helped the field grow, in addition to important contributions by Bales and Gilbert, which your textbook mentions. Currently, IO research focuses on work environment, incentives, morale, and even how taking vacations can affect productivity. Jobs that people have if they study industrial organizational psychology beyond research is often as a consultant to various companies, firms, and workplaces, studying their productivity or the work environment, morale, etc., and making suggestions. Lastly, we look at psychology as it pertains to and helps our legal system. The field grew out of court cases dealing with insanity, like the trial of Daniel Macnaghten for the attempted assassination of Sir Robert Peel, when, after expert medical testimony, he was found not guilty by reason of insanity. Additionally, we saw the influence and convergence of psychology and law in the historic case of Brown versus Board of Education in 1954, when researchers in psychology, psychiatry, and other related fields testified that segregation was harmful. Not just bad, not unethical, but harmful to the healthy psychological development of children. In terms of research, Jung and Wertheimer, as well as our friend Munsterberg that we mentioned just now, investigated lies, false confession, and eyewitness memory. More recently, the latter topic, eyewitness memory, has been extensively researched and written about by Elizabeth Loftus, the author of one of your supplemental readings this week. She's worked with Stephen Clark, a professor and researcher at UC Riverside, on that topic. And incidentally, but I won't say coincidentally because I chose this on purpose, he is the author of the second article for your supplemental readings, and he has actually served as an expert witness in many, many court cases. Other research topics in psychology and law include interrogation, pretrial publicity, and jury decision-making. In closing, we have to look at the whole of the field of psychology as it stands. One aspect that has probably come to your attention is the pluralistic nature of the field. There are many subfields and focuses. In addition, there's a tension between scientific and professional psychology, between PhDs and PsyDs, between experimental focused and practice-focused programs. However, it's important to recognize that psychology is as unified as most other fields are, having many departments, many focuses, many research interests under the larger umbrella of the discipline at the university. That's just kind of what the field is like, and that's kind of what many disciplines are like. Also, it's important to keep in mind that having these subfields perhaps helps keep the discipline together, keep it from splintering, and these great debates raging on, as we've seen throughout the book and throughout our study of the history of psychology.